Welcome to the presentation on injuries to tendons. So firstly, we've been focusing on muscle injuries and we discussed a tendon avulsion within that spectrum. But here we're going to be looking at different types of tendon injuries, why it may occur, and also how we can help in sports massage. You may have heard terms such as tendinosis, tendinitis, tendinopathies. So here we're going to discuss the terminology and why the terminology does matter when we're looking at tendon injuries. So we will start with that quick recap on the level 3 learning on tendon injuries, about what you've learned so far. We're going to begin to integrate the thinking around the Munich consensus on tendon injuries. And then we're going to focus on the Cook and Purdom tendon injury continuum, which is a really interesting way to look at how tendon injuries occur and how we can help. And then lastly, we're going to discuss and identify how to integrate sports massage techniques and home care as part of that treatment program for tendinopathy or tendon injury. What we learned in the level 3 was that a muscle or tendon can be strained, and it's often caused by the overstretching of the tissue, which causes the muscle fibers, tendons, blood vessels, and fascia to tear. And it's based on those 3 grades, so grades 1 to grade 3. What this grading system doesn't do is take into consideration injuries that aren't caused by an overstretching of the tissue, but more of an overuse. So the older terminology was a tendinitis as an example, or injuries or conditions termed as tennis elbow, golfer's elbow, things like that, that aren't caused by that strain, but weren't really classified in a muscle or tendon strain injury grading system. And those are the types of injuries we're going to discuss in more detail within this online learning presentation. Here is an insert from the Munich consensus discussion, which covers all of the different types of muscle injuries that they discussed within the statement. So you can see at the top, you've got the minor partial tears, the moderate partial tears, and then the bigger muscle tears, so the subtotal or the complete rupture of a tendon. The discussion really focused on that continuum of tears of the muscle or tendinous tissue, rather than focusing on symptoms that are where pain is created. There may be a change to the tendon itself, but there is no evidence of a tear either with an MRI, or if it's a bigger tear, there's no palpable defect in the tissue. So this is the focus of this learning today. The word tendinopathy is a really broad term for all painful conditions occurring in or around the tendons. And that's about response to an overuse injury. Rather than a tear, it's an overuse condition. They were originally referred to as a tendinitis, and the suffix itis means inflammation, but there isn't enough research and studies demonstrating that there is enough or any inflammation present during these painful conditions, which is where the word tendinopathy came around, trying to encompass all tendon injuries occurred by overuse where inflammation is not present. It may often be seen as a degeneration of the tendon, which is caused from overuse. And other signs and symptoms that you may see may be a tendon thickening, which is really obvious in tendons such as the Achilles tendon especially. But there may be a loss of function, weakness, and pain. And those common examples you may see in clinic are tennis or golfer's elbow, supraspinatus tendinopathy, Achilles tendinopathy, where there may be a change in the tendon structure, loss of function, weakness, and pain, but no tear. This is the Cook and Purdom tendon continuum, and it was proposed that there's a continuum of tendon injuries caused by degeneration, so from overuse. They're divided into 3 clear stages, but as it's a continuum, clients may be going in between some of those stages or phases throughout their tendon injury experience. So let's break it down into the individual phases of this continuum. The first phase is the reactive tendinopathy. This is where there is a no inflammation response, often caused by overuse. And this may happen if your client has increased exercise with a sudden burst after a more sedentary lifestyle, a change in training, which has happened quite quickly, that the tendon isn't quite prepared for that change in activity levels. There may be some short-term thickening seen in the area of the tendon, but not all of the time. And this is where we want to modify the load of the tendon to heal back to a normal tendon. So this may be a load reduction and then a gradual increase of intensity and load to build that strength within the tendon and muscle tissue, but in a gradual way rather than that sudden burst, which may have aggravated or created that overuse, causing the reactive tendinopathy. If the load hasn't been modified for the client, then they may move into that tendon disrepair phase, where that load hasn't changed from the previous phase. During this phase, there may be some swelling, and some research has found through imaging that there was an element of collagen disorganization around that tendon. But again, like reactive tendinopathy, if we manage the load, we can start to heal and repair that tendon back to a normal tendon. And the final phase in the continuum is the degenerative tendon. Now, this is where the load hasn't been modified and the cell changes that have occurred within the tendon are now irreversible. Research has found through imaging that there is a lot less collagen in a degenerative tendon than a normal reactive or a tendon that's in disrepair. And there has been some research to suggest that if the tendon is continually loaded when it is a degenerative tendinopathy, then there is a high risk that the tendon can rupture and tear. We love this video from Tom Goon, who is a running physio, and this video demonstrates the tendinopathy treatment timelines to give you an idea of some of those timelines when we're working through that tendon continuum. The video is in the online learning, so you can pause this video, watch that one, and then return back to this one. And now we can start to focus on the sports massage guidelines for tendinopathy. As most tendinopathies have little or no inflammation, we can therefore focus on the love phase of this healing acronym. It's all about loading the tissues with the right type of exercise, getting your client to take part in that cardiovascular exercise that they really like, and communicating with them positively and optimistically to help with that treatment process. So the goal for tendinopathies is to help the client move without pain, help them to return to sport as quickly as possible. Just a note, if you've been working with a client that has been diagnosed with a partial or full tear, which includes tendons or tendon avulsion, head to the muscle injuries module, so the structural muscle injuries module, for those treatment guidelines, as it will differ when you're working with a tear rather than a tendinopathy. So why sports massage for tendinopathy? The big thing, I think, is reducing pain. So that combines calming the nervous system, having that pain reduction to create that pain-free window to get them to exercise and load the tissues, which is where tendon repair is really effective. There have been some studies and some research to say that there is some connective tissue changes through friction massage techniques around the tendon as well. So it can be beneficial for that, especially when that tendon is in that degenerative stage. The sports massage guidelines for tendinopathy. Always start with that good client history to find out all of the factors involved, the considerations, why it's happened and what has happened. Discount any of those red flags and always refer for that diagnosis. Assess range of movement of the joint that's involved and check for signs of inflammation as well. In the case of a tendinopathy, if there is signs of inflammation, it may not be a tendinopathy injury and it may be worth getting that diagnosis first before you start treating your client. With a tendinopathy, we haven't got to worry about the phases of healing because there is no inflammation that is present. So we can start straight away around and on the tendon and joint area with techniques such as effleurage and petrissage, which is great to warm up the area, get your client used to your touch. You can add in some soft tissue release techniques, both in longitudinal and transverse planes, which will help reduce that pain quite quickly, improve the proprioception at that particular joint as well. So it's a great technique for a tendinopathy. The next big technique to consider is friction massage on the tendon. And over the years, there's been quite a bit of research about friction for tendinopathy. So let's explore that in a little bit more detail on its own. For friction massage, there are some possible and plausible reasons why it really works for a tendinopathy. It requires less stress on the tendon than other soft tissue techniques because of the small movements which may affect the tissue positively. Some researchers found that it may stimulate new connective tissue around the area, especially if there's been a loss of collagen if you're working into that tendon disrepair phase. Friction techniques is a great distraction from pain. It creates that new stimuli, which helps with that pain reduction. But I think the thing to consider with friction massage on a tendon is not trying to create more pain. It's working with your client so it feels comfortable and tolerable, and you're not trying to induce more pain, as that can aggravate how your client is feeling. And our goal is not to be creating more pain as a massage therapist. We know that massage has a greater effect on the nervous system, and creating more pain creates that sympathetic nervous system response, which is what we're trying to avoid. So our goal is really to calm the tissues down. So if you're using friction on a tendinopathy, think about how it's feeling for the client, and you want to make sure you're calming that client down, calming their tissues down, and not creating unnecessary pain. Which then leads into discussing chronic pain and tendinopathy. When clients have had tendinopathies for a very long time, it may become more about the pain and less about the tissue damage. So we don't want to be creating more pain with friction massage, but focusing on those strategies that help calm and restore the client through your hands-on work, education, and also with kindness as well. So think about that positive language, the optimistic language that you can use with your clients. As with all indirect injuries, it's about thinking about the whole body approach. So what may else have been happening which creates that tendinopathy? Is your client experiencing any posture, movement restrictions, which are creating aggravating factors for that tissue? It's about thinking globally and not just locally at that particular tendon itself. Some other modalities that may be quite useful is instrument-assisted massage. If your client is guiding movement and avoiding load, using the tool is a great way to help encourage that movement. So if you're qualified to use instrument-assisted massage with movement, then you can use that to help with tendon injuries. Kinesiology taping is also really good to help offload the tendon during a tendinopathy, so you can add in some more movement and gradually add that load in for that tendon. So again, if you're qualified to apply kinesiology tape for tendons and joints, then this may be another modality to help with your whole treatment practice. But again, it's about using your massage skills with the taping and also with movement to create that whole treatment plan and not just adding tape on for effect. We've touched on this quite a bit in the presentation and in previous learning, and it's always about thinking globally as well as thinking locally. Consider what else is happening based on your subjective and objective findings that may be creating that tendinopathy or aggravating that tendon. And it's often the case, it's often multifactorial, so it's not just based on a particular movement that be happening, but what the whole body is doing at that particular moment in time. Exercise and loading the tendon. Exercise, particularly eccentric exercises, has been shown to really affect positively the tendon structure and also reduce pain. So exercise is really key to help with tendinopathies. Isometric exercise has also been shown to help. It creates an analgesic effect, so a pain reduction or the reducing the client's experience of pain, which is really important when you're trying to build strength within a particular tendon or muscle. Eccentric exercise has also been shown to increase the collagen production in abnormal tendons and improve the structure of a tendon in the short term and the long term. So if you go back to the Cook and Purdom continuum, there are cell changes and collagen changes within a reactive tendinopathy through to a degenerative tendon. So exercise, or especially eccentric exercise, can really help improve that collagen production and help with that healing process. If your client is experiencing a tendinopathy and they're experiencing pain, it can be quite difficult to get them to take part in the home care exercises that you've provided for them if things hurt. And this is why client education is really important to help them understand that actually exercise and loading the tissue will help their tendon get better. A way to do this is using the pain monitoring model by Silbernagel al. They found that using this program had a positive effect on exercise and Achilles tendon injuries. And this is a really good visual to show your clients. So you can see from the green, between a 0 and 3 of pain is okay to exercise. As they move into that 4 to 5, they want to exercise with caution. And if it goes over into that 6, that's when they stop. And that's a really good indicator, so they know that they can exercise through some discomfort. When describing this model with your client, think about the words that you use as well, because that's really important when you're discussing pain. When I describe this to my clients personally, I don't use the word pain. I describe it as a continuum. So 0 is where you feel amazing, it feels so good, and then 10 is like it feels really bad. So I try and just change the wording slightly and avoid the word pain, which will help how they feel, how they experience pain. It's important to know how much load to create for that tendon as well. There's a couple of studies around this. Alfredson created a specific model or protocol of 15 repetitions, 3 sets, 2 times a day. So it's 180 repetitions a week for 12 weeks of pure eccentric exercise, and had some good results with that. And Silbernagel found that and suggested that load can be combined based on the patient's tolerance to exercise. And I think the latter approach is better for a lot of our clients, because we can manage their expectations, manage their load, but also challenge them at the same time. So it's not so restrictive, but based on the client's tolerance levels. So when you're prescribing exercises for your clients, think about their tolerance, think about the adherence that they will be able to do, and manage that accordingly. So it doesn't have to be as prescriptive or restrictive as the Alfredson model. Some home care take-homes. To improve tendinopathy, the tendon needs to be under adequate load. So that's really important, that the exercises that you prescribe are taken from your client and adhered to. Use slow repetitions to increase that time under tension. So think about the eccentric loading exercises. Choose exercises that the client will definitely adhere to. There's no point prescribing them things that they will not achieve, because you're not going to get the results that you want. And it's important that they can learn how to manage the load themselves as well. Ensure your client is accountable for the work that they do for the healing process. They don't become reliant on you to help them with their tendinopathy. And then lastly, think about those isometric exercises in the beginning, which will help them with that pain reduction instantly. And they're really good ones to begin with when you begin to provide that home care program for them. And finally, here are some further reading and resources from this presentation to research tendon injuries and tendinopathies in a little bit more detail.